Alzheimer's disease is a disease that attacks brain cells and neurotransmitters. It can be managed using several medications, however currently has no cure. So what is Alzheimer's disease? AD is the most common cause of dementia. It is broadly classified as a neurodegenerative disease, which basically translates to a loss or degeneration of neurons in the brain, as well as the formation of amyloid plaques and neurofibrillary tangles. The loss of neurons in the cortex of the brain leads to a set of symptoms that characterize dementia. For instance, persistent and frequent memory loss, difficulty learning, and emotional unpredictability. The sporadic cause of Alzheimer's disease makes up 90 to 95% of cases, meaning age is a major risk factor, or it can be familial, which is a result of a rare genetic condition. Diagnosis of the disease is difficult as it often involves a brain biopsy after autopsy. However, medical history, physical and neurological examination, along with medical imaging can assist with the diagnosis. Although the exact cause of the disease is unknown, medical science has developed several hypotheses to try and understand its pathophysiology. The main hypothesis that explains the disease is called the cholinergic hypothesis, which states that a possible cause of AD is the loss of central neurons and the deficiency of acetylcholine, which is a neurotransmitter involved in learning and memory. As mentioned before, there is no cure for AD. However, there are several drugs that aim to prevent the progression and manage the symptoms experienced by patients. In terms of drug therapies, the FDA has approved a class of drugs called cholinesterase inhibitors, which regulate and manage AD symptoms. The most common and effective drug for mild, moderate, and severe stages of the disease is called Donepezil, or more commonly known as Aricept in the market. Under normal conditions, cholinergic neurons in the brain synthesize acetylcholine from acetyl-CoA enzyme and choline. Acetyltransferase upon arrival of a neural impulse allows acetylcholine to be released into the synaptic cleft, where it interacts with acetylcholine receptors located on the postsynaptic neurons. This is where we have a cholinergic response. Shortly after, acetylcholinesterase enzyme terminates acetylcholine function by breaking it down into acetate and choline. In a patient with Alzheimer's disease, there is a decrease in acetylcholine because of its breakdown by this enzyme. By inhibiting this enzyme, we're able to increase the level of acetylcholine in the brain. Due to this mechanism of action, Donepezil is the most sought-out medication to treat Alzheimer's disease-related symptoms, as it compensates for the loss of functioning cholinergic brain cells. However, it does come with certain side effects, which can range from mild, such as diarrhea, loss of appetite, and vomiting, to severe, including breathing problems and convulsions. Memantine is another drug used to manage medium to severe stages of the disease and belongs to a class of drugs called NMDA receptor antagonists. This drug works differently to cholinesterase inhibitors by blocking the effects of glutamate. Glutamate is a neurotransmitter in the brain that leads to neural excitability and excessive stimulation. By blocking glutamate, it inhibits the influx of calcium into the cell, which leads to improved symptoms of the disease, including increased cognition, memory, and enhances neural synaptic plasticity. The use of cholinesterase inhibitors such as Donepezil has allowed patients with AD to better manage their symptoms on a daily basis. 70% of patients found that the intake of Donepezil improves temporary symptoms such as anxiety and the ability to perform daily tasks. The drug also offers long-term cost savings as it may decrease the need and strain for a caretaker in certain situations. A study was conducted in 2015 on the changes in caregivers' burden in AD patients after a dosage increase from 5 to 10 mg was made. Over the 16-week study, 20 out of the 27 patients showed at least one stage improvement in relation to the 5 assessed aspects of daily life. The dosage increase for Donepezil was able to lower the mean score for caregiver burden due to personal strain and thus improve the quality of life for both caregiver and patient. A randomized study was conducted by the researchers at the University College of London, where they found that ceasing the intake of Donepezil could worsen the ability of a person with AD to perform daily activities, and therefore lead to early transfer to a nursing home. The 295 patients involved were separated into 2 groups. The first group involved patients discontinuing Donepezil and starting Memantine, and the second group involved taking a combination of both. During the first year, fewer patients that continued to take Donepezil entered the nursing home, compared with patients who stopped taking the drug. In America, the estimated cost of caring for patients with Alzheimer's disease reached $277 billion by the end of 2018. With this number expected to increase, the clinical potential for Donepezil in managing symptoms and prolonging the need to be admitted into a nursing home is promising for patients with the disease.